My name is Dr. Chad Versio, and I am trained in internal medicine and pediatrics. You may have heard there are things in vaccines that aren't related to the virus or the bacteria that we're trying to stimulate the immune system with. Now, my first thought is that these things or these discussions often get in the way of us actually thinking about the vaccines themselves and the risks and benefits of the vaccines. The fact is, vaccines save people from having permanent paralysis from polio, death from diphtheria, or permanent damage from meningitis that's vaccine preventable. But it's legitimate to wonder what is in them and why. The sad part is that there are political figures who are adding to the misinformation around some of the things which are in vaccines. Let's start with the one that has generated a lot of controversy and you may have heard about, thimerosal. Despite literature not showing a risk of health problems in many studies, including autism and developmental issues, out of an abundance of caution, thimerosal was removed from the childhood vaccines except multi-dose flu vaccines since 2001. So please don't let this be a reason your child doesn't get vaccines. But let's talk a little bit about why it was included. Thimerosal is a form of mercury which does not build up in the body like other forms. It is used as a preservative to keep bacteria or other germs from growing in the vaccine vial, which could cause serious problems. It has been used in vaccines since the 1930s. One of the other things which is included in vaccines is aluminum. There have been many studies that have looked at the possibility of problems and have found no relationship to autism or other types of problems from aluminum. There are lots of other places that you or your child get aluminum into your body. One quick example is antacids. And there have been studies that look at those who have been vaccinated, and there's been no significant change in their aluminum blood levels compared to those who had not been vaccinated. So the good news is no harm. But then the question is why do they use aluminum in vaccines? The benefit in the vaccine is that it helps increase the immune response to the vaccine, meaning lower doses can be used as well as less doses. These are two additives that have received the most attention and show that scientists are careful about what is included in vaccines and have good reasons for the additives. The CDC actually has some very useful information, so I really encourage you to look at their website and understand in more depth why different additives are in the vaccines.